Hey, it's Nikki, our Beach with My Babies. This is about day 3 post-op of my lower body lift, and I thought I would catch everyone up on kind of different things that have been going on. Um, I mentioned in my last blog about my crappy nurses. I did have that one really great nurse the last day I was there. One really good nurse in the evening, but I had a really bad recovery nurse, and I also wasn't put on the plastic surgery floor for my recovery because it was full. So I was put on the dialysis and kidney ward, which is a different floor. And sorry, my TV's freaking out. What that basically resulted in was a bunch of nurses who were totally unfamiliar with plastic surgery needs, and things didn't get done, I'm discovering. Firstly, I was supposed to probably walk within getting up, being woken up from anesthesia, and they didn't get me up to walk for about probably at least 24 to 36 hours after my surgery. So I had a lot of just pain, but I think that's probably normal whenever I would get to walk. I've been walking more. I can't walk more. I joke that I look like a 97-year-old. I have a walker. My doctor didn't think I was going to need a walker when I inquired about that. There's two things, though, that I definitely needed. My walker, I can't walk without it because I'm hunched over a lot because the tension in my hips and my back are so great that I can't stand up all the way, which goes back to what I was mentioning in my first video, which is that you need to have really strong quadriceps as well as really strong biceps, because it's your biceps that basically are going to hold you upright because your abs are kind of out of commission. And then it's your quadriceps that are going to be lifting most of your body and while you're walking, but also pushing you into bed and getting you shifted and things like that. I was able to get out of bed for the first time by myself today, which was great. I was also able last night to sleep modified on my side with a ton of pillows, probably about 7 pillows all around me, propping me in different angles. But my tailbone and my butt hurt really bad because I've been on my tailbone and my back and my butt pretty much nonstop. So sleeping on my side and getting that relief was really, really great. So those are kind of a couple of things I needed. The walker. The other thing is a raised toilet seat. I went to Rite Aid and I got a toilet seat that raises me up about 4 inches than the normal. It sits on top of the toilet, my regular toilet. That's been nice because I haven't needed to squat. Now, luckily, my quadriceps are strong enough that if I need to squat that low, I can do it solely with just easing myself down with my walker and my quads. But the raised toilet seat definitely makes things easier, especially right out the gate. What's nice, too, about sitting on the toilet, which I spent a lot of time in the hospital actually just sitting on my commode, which sounds awful, but there was no pressure at all on my tailbone when I sat on the commode. And once they had taken my catheter out, I was able to just kind of sit there and use the restroom and put relief off my tailbone. So I know that sounds kind of gross and disturbing, but it was actually really, really nice to have. We've got the toilet seat and the walker. The other thing I talked a little bit about was my pain pump, and I got it actually. It's still syringe. There's a suit it's sewn into my belly button, and it dispenses numbing medicine. But this is what it looks like. It's got this like kind of belt-like thing. I can't wear the belt obviously around my middle because my middle's all tore up. So I wear it like a necklace around my head. And then I've got 4 drains, and I pin my right drains here and here on this, and I pin my left drains here and here on this when I go walking. And it all hangs around my neck. Obviously, it hurts a lot if any of those pull because the drains are sutured into kind of my pelvis area. Right, like kind of where my pubic area is. That's where all the drains enter. And then the syringe, the soft syringe for the pain pump goes into my belly button. And there's probably, it looks like 5 feet of like this super, super thin, let's see if I could show it to you. Like this thin, see this little cord down here? It's coiled all the way on my stomach, and they've actually stitched it onto my stomach, so it can't. So obviously when that gravity takes hold of that and it goes lower than anything, it pulls a lot on my stomach, which hurts. So I keep everything kind of around my neck so that there's no tension at all on my pelvis or on my chest when I'm walking around. The Other thing I've been doing, still haven't had a bowel movement. That's not uncommon, obviously, because I'm on a lot of pain pills. But something that I've started putting in my food twice a day are chia seeds. This is daily fiber. Basically, 2 tablespoons is 14 grams of fiber, 50 calories, a gram of fat, and 8 grams of protein, as well as omega-3, omega-6, phosphorus, magnesium, potassium, calcium. I have a morning bowl of oatmeal, and I put this in my oatmeal, which is delicious. I've been enjoying that. And then I can also mix it into smoothies if I want to make a smoothie, or sprinkle it on my food, mix it into stuff. It doesn't really have any sort of flavor to it. This one's ground. Let's see if I can kind of see. It's like powder. I would say that it tastes kind of, there's like a really light and fluffy version of like almost like a sunflower seed meal. So it's not bad at all. It'd actually be probably pretty good sprinkled on salads and things like that as well. But I've been trying to eat that. So I've had that as well as my stool softener and things. The other thing that I've been having every day now is I've gone back to the Flintstones. I really dislike the flavor of these just because I overkilled them with my sleeve surgery. But I am doing the Flintstone vitamins. And I'm taking my biotin again, and my what other ones? B12, and then the evening my calcium and my D3, so that I'm getting all my vitamins in. Let's see if there's anything else. Oh, super important. The thing that the nurses neglected to do while I was in the hospital, besides getting me up and walking around ASAP, because walking obviously keeps your level of blood clots risk very low, as well as it keeps your blood circulating and it keeps your skin stretching so that all these fluids keep moving. Like I said, I have 4 drains. The nurses were supposed to be stripping my drains every 3 to 4 hours, and they never stripped them when I was in the hospital. So I have blood clots in my drains that my husband and I have been kind of like working to, like, you strip it to get it out. This morning I woke up and the blood clots had gotten so bad in one of my drains that I was actually seeping from the area where the drain enters. And I know that sounds really gross. I called the doctor. I was really worried about it. I stripped the drain, and it went away, basically. But when I talked to the doctor basically now wants me to strip the drains about 6 times a day, because they weren't properly cared for. So tomorrow I'm going to try to get into the doctor because my pain pump will be out of medicine. So I'm going to try to get that off of me. Basically, I've got like 5 things attached to me right now that I want off as soon as possible. So pain pump hopefully will come off tomorrow. One of my drains has never been producing well, and I think it's because there's a clot, just because the nurses never took care of it as they should have. So I'm going to have that evaluated, and I'll update everybody on like what's going on with the drains. Other than that, I think that's about it. Just been drinking a lot of fluids. I've been eating a lot of food. I've been really hungry. I wasn't given a lot of food. That was the other thing. The nurses didn't know what I needed to eat. So for like 48 hours, I basically had Jell-O and some broth, which made me really, really weak, which I think contributed to my blood pressure tanking that first time I tried to get up. Anyway, yeah, so I will talk to you all soon, but that's kind of what's been going on.